Thank you, share.
Good evening, everyone. We're just about ready to begin. My name is Bridgette Baker, and I'll be your producer for this evening's event. And before we get started, I do have a few housekeeping items to review. This evening's webinar is being recorded and broadcast live on Facebook, so feel free to invite your friends on social media to join in. If this is your first time using the Zoom platform, on the bottom of your Zoom screen, you'll see the main toolbar that has, among other things, audio settings, etc. And towards the right, you'll find your chat function. We highly encourage you to use the chat to express your thoughts on any of the topics we'll discuss tonight. You'll also find the Q&A button on the bottom toolbar. And although we won't be answering your questions in real time tonight, do feel free to use the Q&A button throughout the presentation to pose your questions, and we'll address as many as we can at the end of the discussion. And of course, we encourage you highly to participate. Since this evening's discussion is a forum that was designed for you, the community, we encourage you to remain attentive and participate as much as possible via the chat and Q&A functions. And I thank you for your attention during our housekeeping review. I now hand the floor over to Mariko Bennett, Vice President of the Metro DC chapter of the National Coalition of 100 Black Women, for our introductions.
Excellent, and thank you so much, Bridgette. Welcome, and thank you for joining us for Our Health, Our Community, Mobilizing for the Survival of Black Women. As Bridgette mentioned, I am Mariko Bennett, the first Vice President of Programming and a chartering member of the Metropolitan Washington, D.C. chapter of the National Coalition of 100 Black Women. This national webinar marks the launch of Our Health, Our Community, a new initiative led by Black Women Health Imperative and the National Coalition of 100 Black Women. We have partnered to mobilize, support, and advocate for Black women and their families in effort to create post-pandemic solutions that contribute to healthy, resilient Black communities. It is my honor and privilege to introduce two phenomenal Black female leaders at the helm of this initiative. After my introduction, you will hear from National President Virginia W. Harris, immediately followed by President Linda Goler Blunt. Dynamic, highly respected, public servant and community leader. All of these words and more describe the National Coalition of 100 Black Women Incorporated, National President Virginia W. Harris. President Harris was reelected to National President for a second term in October of 2019 and has served as a member of the Metropolitan Atlanta chapter for 29 years. She has served as a board of director for numerous organizations, and just to name a few, past president of the Albany State University Foundation Board of Trustees, past chair of Georgia DOL statewide Youth Motivation Task Force Program, vice president of the Gwinnett Rockdale Newton Community Service Board, National Forum for Black Public Administrators, NFBPA, American Red Cross Advisory Board, Southern Education Foundation, and she is a member of Women's Ministry Council and the Ladies Usher Board at the historical Ebenezer Baptist Church. Thought leader, trailblazer, social justice advocate. All of these words and more describe Ms. Linda Goler Blunt. Ms. Goler Blunt joined the Black Women's Health Imperative as the President and Chief Executive Officer and February of 2014. As president and CEO, she oversees the strategic direction for the imperative and is responsible for moving the organization forward in its mission to achieve health equality, reproductive and social justice for Black women across the lifespan. Ms. Goler-Blunt served as the Vice President of Programmatic Impact for the United Way of Greater Atlanta, where she led a team focused on achieving transformation in health, income, education, housing stability through place and population-based work. With more than 25 years of experience in the public, for-profit, and nonprofit sectors, President Goler-Blunt has a distinguished career that includes successful tenures at the Coca-Cola Company, leading strategic business initiatives, and the U.S. Centers for Disease Control and Prevention as an expert scientist. Now we will hear from National President Virginia W. Harris, followed by President Linda Goler-Blunt. Thank you.
Good evening. Thank you, Mariko, for that very kind introduction. It is my honor to bring greetings on behalf of the National Coalition of 100 Black Women Incorporated and all of our members in our 61 chapters, 27 states throughout the country. NCBW was founded in 1981 in New York City and is a 39-year-old advocacy organization whose vision is that one day Black women and girls will live in a world where socioeconomic inequality does not exist. It was essential for NCBW to partner with Black Women Health Initiative and Ebony Magazine for a national campaign and webinar series about Black women health, titled Our Health, Our Community, Mobilizing for the Survival of Black Women Beyond COVID-19. We are battling dual pandemics, COVID-19 and racism, and Black America is bearing the burden. Despite representing just 13% of the US population, Black people make up 27% of US COVID-19 cases. Nationally, Black COVID-19 mortality rates are nearly 2.5 times higher than white and twice as higher as that of Asian and Latino population. Considering the Black women lead over half of our households in the Black communities, their health and well-being are of our utmost importance. Thank you, and now I'll turn it over to President Blunt of Black Women Health Imperative.
President Blunt, we're having issue with your audio. I'm not able to hear you.
Okay.
Okay, now you're on. Thank you.
Thank you, President Harris, and thank you, Marco Bennett, for that lovely introduction. Good evening to all of you. I'm so happy to be here this evening to discuss our health, our community. The Black Women's Health Imperative is proud to partner with the National Coalition of 100 Black Women and Ebony in order to mobilize, support, and advocate for Black women's health and for that of their families. And I'd also like to thank Congresswoman Joyce Hannah-Beatty and my esteemed sister panelists for joining this evening to talk about this very important issue. It's my hope that we can raise awareness around the causes of health disparities and understand the lived experiences of Black women and their role in COVID-19. And I'm looking forward to discussing solutions so that we never find ourselves in this place again. About 37 years ago, the Black Women's Health Imperative was founded on Spelman's campus by Billie Avery when she brought together 2,000 of her closest friends to talk about how we need to take care of ourselves and take care of each other. So for 37 years, our focus has been on chronic disease prevention, risk reduction, maternal mortality, HIV prevention, and reproductive justice. Policy undergirds all of our work, and we translate research into language that the everyday Black woman can understand and use. We know a little something about Black women, as does the National Coalition. And the one thing I want everyone to know is there's nothing wrong with us. We did a study a few years ago of 5,000 women and asked them to define health, and we found that they don't see themselves, we don't see ourselves as broke or broke down. We see ourselves as resilient and more than capable of taking care of our health. But that can be a challenge. In 1989, Kimberly Crenshaw coined the term intersectionality. Black women live at the intersection of 3 oppressions: racism, classism, and gender discrimination. And now here we are at yet another intersection. The worst health pandemic in 100 years, the most intense and widespread protest against racial injustice in 50 years, and the worst maternal mortality rates in 20 years. All of this against the backdrop of the best progress in new business development and entrepreneurship, college graduation rates, and life expectancy. Yesterday, the Washington Post article reported that 41% of Black people in this country have experienced depression or anxiety as a result of COVID-19. And with a vaccine likely years away, it's hard to see the end, and it's hard to see how this improves. What do we do? There's a technical term many Black women have been using lately. It's a lot. But I have hope. What I want us to take away from this evening is that we have a voice and it's strong. We can speak up, we can speak truth to power, we can support our sisters, our colleagues, our friends, we can support our elected officials and potential candidates. There's some women on the front lines: Kamala Harris, Val Demings, Stacey Abrams, Susan Rice, many others like Congresswoman Joyce Hannah Beatty, who need to know that we support them and that there's an army of Black women behind them. Vote, know the issues up and down the ballot, all the way down to the school board. As we saw a couple of days ago in Baton Rouge, Mr. Gary Chambers showed that the school board is every bit as critical to our health as the governor's office. There will be life beyond COVID-19, and it's our time to determine what that means for Black women, our health, and our community. Thank you.
It is my pleasure to introduce our moderator for the evening, Angela Rye. Ms. Rye is one of America's most influential voices for positive change in the political process. She delivers thoughtful and incisive commentary and real talk about the power of activism, advocacy, and politics, and stokes much needed conversation about the state of America. Angela brings unyielding truth to audiences and empowers others to use their voice to create positive change in the political process. She is the principal and CEO of Impact Strategies, a political advocacy and racial equity firm. She is the host of On One with Angela Rye and commentator for CNN. She has been seen on several programs and outlets from Breakfast Club, TV One, ABC, and BET, where she's been nominated for multiple NAACP Image Awards. She served as the executive director and general counsel for the Congressional Black Caucus. I present to you a thoughtful leader, a friend, our moderator, Ms. Angela Rye.
Thank you so much, Tammy. What an honor to be introduced by someone who's a dear sister, friend, and someone I deeply admire. Welcome to all of you. I'm going to request that the producer reduces this screen so that the guests that we have participating in today's town hall can actually see everyone. So I'm happy to go through the bios, but right after we do that, if we can enlarge the screen back so you can see all the panelists, that would be great. So again, thank you all for allowing me to serve as your moderator this evening. Tonight you'll hear from some great, amazing, educated, brilliant, Black girl magic type of folks talking about something that's near and dear to so many of us. I know that Madam President has already referenced the fact that we are truly living within a pandemic within a pandemic. And so tonight we will talk about all of that with this particular focus on COVID-19. Our panelists are Virginia Kane, Dr. Virginia Kane, who is the Director and Chief Medical Officer of the Marion County Public Health Department. She also serves as an Associate Professor of Medicine at Indiana University School of Medicine Infectious Diseases Division. She's chair of the National Medical Association Infectious Diseases Section and a board member for the CDC Morbidity and Mortality Weekly Report Editorial Board. She's also a member of the National Biodefense Science Board, which provides guidance to the Secretary of the U.S. Department of Health and Human Services and the Assistant Secretary of Preparedness. So if you all were ever going to question the validity of that information, we have receipts. Next, we have Nurse Alice Benjamin, who is an on-air health, medical, and wellness expert, affectionately known as America's favorite nurse, a nationally board certified cardiac clinical nurse with over 20 years of experience. She's an American Heart Association spokesperson and was elected to the American Nurses Association California Board of Directors. She has appeared on the Dr. Oz show, which means my grandmother, who's 102, has definitely seen you. The Doctors, CNN, HLN, Fox and Friends, Dr. Drew on Call, and more. She's the nurse that we all want to know. Thank you so much, Nurse Benjamin, for being with us. Next, we have attorney Alethea M. Jackson, who is a good sister friend of mine as well, who has years of experience in public affairs, in government relations, and in communications. She is an executive with 20 years of success, not just experience, success, with Walgreens, America's Health Insurance Plans, and National Association of Insurance Commissioners. Throughout Alethea's career, she has been recognized for her ability to develop high-impact strategies, structures, and partnerships that have shaped public policy, elevated brand identity, and advanced corporate and industry policy objectives. Alethea sits on a cross-functional COVID-19 response team, navigating federal, state, and local rules related to pharmacy and retail operations, access to testing, and advising Walgreens C-suite executives on key policy issues related to the pandemic. All my friends is bad. Ladies, I'm waking you up. I'm making sure you're awake because we'll read these bios, but I want you to know we got heavy hitters in here. I also am going to briefly introduce Congresswoman Joyce Beatty, who is truly a woman after my own heart. She is doing so much important work. She's done a ton around health, but she's also doing some really great work in the financial services space, particularly around diversity and inclusion. And I'm bringing that up because there is work that can be modeled from the place where she sits on financial services and in the Energy and Commerce Committee that oversees healthcare, right? And so what we're hoping is by elevating some of the work she's done in D&I and diversity and inclusion, that those practices, those best practices will be emulated in the healthcare system, which is where we find ourselves this evening. And so I want to just again, thank you to all of the attendees. You all are the real MVPs and the VIPs. And while you all won't be named tonight, know that your Black Life Matters, and we're so glad you joined us this evening. So I want to start here. We are in the middle of a crisis. And so many conversations that I've been on, and ladies, I'm sure you all can relate to this. You're hearing things like, we don't know how long this window of opportunity is going to last. We don't know the things that we need to move right away because it's a crisis, but we know that people over time, their consciences begin to get seared. The ways that they start thinking about these things changes, and this window of opportunity may be closing. When you think about what is immediately before us because of the deaths of Breonna Taylor, which, by the way, if you don't know, it's been 102 days and her killers have yet to be arrested. I hope we can also take a moment to take action on that. That is a part of our health, our mental health, our physical health, and our ability to survive. When we think about George Floyd, Rayshard Brooks, and Ahmaud Arbery, we haven't seen this type of national outcry in some time. And we know that Ms. Blunt also talked about this. What do we need to do, ladies, to ensure that we capitalize on this very important moment and we really begin to build power? Collective power, power in unity. We know this is the case, but to build power to ensure the changes that we need are permanent and not just a part of a moment. And I'll let any one of you jump in.
Hi, Angela. I'll hop right in here. I think we need to look for true actionable steps that people can take. And it's great that people empathize and are supportive of Black Lives Matter, but everyone can do something based on where they sit, because it is systemic. And so it's racism that addresses us at every level, whether it's the financial institution, whether it is school systems, whether it's courts or corporate. And so making sure that we are developing action steps that are measurable based on where we sit in the system. And so really asking and challenging people to do so.
Yeah, that is so true. And we need to understand, make sure we understand the issues, like really understand them. I don't know how many people listening have gone to the polls and voted for people and they didn't know exactly where those people they were voting for stood on the issues. So we need to make sure that we understand what their positions are, what they've done, what they bring to the elected office, and then hold them accountable for that.
Anybody else want to weigh in here? Well, let me just raise, Dr. King, you look like you were getting ready to say something as soon as I started talking. I don't want to cut you off.
Well, I just think that we need to have a better understanding and underlying rationale for why we have seen our African Americans disproportionately impacted by the COVID-19. When you look at Chicago, they make up like 26% of the third of the population, but they have 3/4 of the deaths that occurred from COVID-19. They had almost 45% of the cases. This happened in Milwaukee, happened in Detroit, even places such as Indianapolis. So why is that occurring? And so we look at the structural racism that has taken place that we see with the individuals that you name. But I think the key thing is we have to look at that poverty has a huge impact on us. And this is a long time structure that's been put in place. And because of poverty, we have a lack of insurance or access to health care, and people couldn't even get tested. So they called the ambulance. I'm sick. I've got a fever, 102. I need someone to pick me up so I can be evaluated in the emergency room. No, and the response will be, hey, we need you to be really, really sick before we will pick you up. So you just be fine and wait till you're really, really sick. So a lot of our clients, they get in late in their stage of the disease when they're getting into the hospital and they're being hospitalized. But I can't stress enough about the stress that impacts our immunity. So that when you look at the stress that we're facing in our community, whether it's income inequality, whether it's discrimination, even the violence and the institutional racism, that chronic stress lowers our immunity, making us way more vulnerable to being impacted by this COVID-19 and this infectious disease. It's almost like, you can be in an environment where you're getting post-traumatic stress disorder. So not only the immunity standpoint, but you've got a psychological behavioral trauma that's going along at the same time. And so it's no wonder that we're being hospitalized at a higher rate. No wonder that we're dying at a greater rate because we're so vulnerable related to all of these issues.
Thank you. And I think to that point, Dr. Kane, that you just raised around the stress that impacts our immunity. One story that I'll share with you is my best friend the other day was telling me how she was feeling like this heaviness in her chest. And I was saying, I'm feeling the same thing. So she booked a doctor's appointment to talk to the doctor about the chest pain because it wasn't going, just like this heaviness in her chest. When she went to the doctor said, you're the third Black patient I've seen today that talks about this heaviness that you're experiencing in your chest. Why am I raising that? I think that oftentimes we are taught to be strong and to look past things because, we should be used to it. We should know the trauma, but you just raised the point around PTSD. And I think that we all really have suffered from PTSD in a lot of ways, just living in this country under systemic oppression and racism. I would love to hear from some of you about ways that we can use that pain and that trauma again in this moment to ensure that, the moment doesn't disappear. And I see that Congresswoman Beatty has just joined us, and what a perfect time to transition to this powerhouse. I see I know Ms. Beatty's mic is muted, so if we can unmute her, I would definitely love to ensure, yes, that you have the floor based on the resolutions you've introduced. I already talked you up. But I want you to talk to us a little bit about how we can move forward with this moment, with the calls to action that we know we need to be working on, with the movement building that we know we need to be a part of. And Ms. Beatty, of course, how we can support you and your colleagues in the Congressional Black Caucus. Thank you for joining us.
Well, first of all, Angela, let me say to you and to all these bad, strong sisters who are on this call representing many different organizations, wearing many different home, community, and work lives. This is truly an honor for me. It's an honor to serve in the United States Congress and to be vice chair of the Congressional Black Caucus. But as I had the opportunity to listen to much of what many of you were saying, as it centered around healthcare, as it centered around all of the racism and suppression that certainly we have felt over the years, there's not enough legislation to legislate away hatred. So we have to, yes, have legislation. And for me, that draws attention and embraces and gets us excited and gets on board. That's what we're seeing across the nation now. You know, when you think of how many George Floyds we've had, when you think of how many Breonna Taylor that we have, when you think, when we go back to our earliest history, the Ahmaud Arbery, lynched, shot down as he was running. This is not new, but what is this movement. In movements across my lifetime and before, that's been the only thing to change our history. I mean, think about it. Rosa Parks wasn't the first Black woman to say, I'm not getting up and to get arrested. But she was the right one at the right time. George Floyd was the right one at the right time. And when you see him, Angela, with his little girl on his shoulders, before his death saying, Daddy, you changed the world. That gives me chills because George Floyd was the right person at the right time. We got our white allies marching with us. We have white kids in suburban areas sticking their hand up and talking about Black Lives Matter. And then we have first-time Black folks getting out and saying, I need to do something. We have us. All of this power on this call is because it's the right time for us. And having you convene us, having so many strong Black women, National Coalition of 100 Black Women, National Council of Negro Women, and all of us here. So what can we do? There's enough work for all of us. So when you think of the reason that I did this House Resolution 990, why am I sending it out to everyone? Because it might be one vehicle that we can use. It is certainly not the only vehicle. But I think it's important for us to decide what we stand for. People have died because of racism. And in many, poverty are public issues because of racism. Well, that's not new either. Look how many years we've been fighting for access to equal and affordable health care. And then Barack Obama came along. And when we called it the Affordable Care Act, people that didn't like Obamacare were saying, oh, I don't like Obamacare, but I like the Affordable Care Act. They were one and the same, as we know. So when it comes to us, when we are right in the right movement, it makes a difference. So this is one vehicle. What we're doing tonight is I've listened to the sister talking about healthcare and others making strong statements. This is our time. So we go back to Washington tomorrow. We are making a bold statement that we're going to be attacked for because Nancy Pelosi has decided, because of Congresswoman Karen Bass leading the Congressional Black Caucus, a member of the Judiciary Committee with 7 other Black members sitting on the Judiciary Committee. This is our legislation. And we have named it George Floyd Justice in Policing Act. This will go down in history as one of the most unprecedented things we've done in these turbulent pandemic times. Maybe there's a reason that we got attacked with COVID-19, something none of us have ever witnessed in our lifetime. Who would have ever thought that we would have 2 national pandemics at the same time? That you would bring together what we have in healthcare and what we have now in the injustices in our own system. Black women make up the base of voting. Black women make up the base in now working in the workforce. Black women now are in the numbers, small as they may be, in corporate America, in our school systems, in our healthcare systems, running major agencies across the country. In my lifetime, there was a time you wouldn't have seen a Black woman leading the United Way or the YWCA. Now we are everywhere. So the question becomes, Angela, or the answer is, how do we capitalize on this? There are only 24 other women in the United States that look like me, but we are some of the baddest sisters in the Congressional Black Caucus. So bad that 2 of them are on the short list to be vice president of these United States. And I just don't think we can let our time go by. Look at the power on this call. We got Angela Rye moderating us, putting us in check and putting the word out there. So I just want to be excited to be here, to be part of the dialogue. I'm coming back to Washington tomorrow. On Thursday, we will vote on the George Floyd Justice in Policing Act. I will have hundreds and hundreds of people from across the United States signing their signature to be a part of my resolution saying that it is a national crisis. Racism is a national crisis, and we don't stop. And we talk about the injustices in the wealth gap. We talk about the injustices in healthcare. We know from the pandemic and the research that we have that it is not only healthcare. If you look at our heartland in the Midwest, where we only make up less than 25% of the population, but then we have 30 of the people dying who are Black. We have 35% of the people who are testing positive. So when you talk about disparities and how disproportionately we are affected, go to COVID and the economy and the money. When we put it out there, we put $2 trillion, more money than we had ever put in the history of Congress, a bipartisan vote. And what happened? In the first 10 days, $350 billion gone. Black folks didn't even get in the queue. Small businesses, and we know that's code for minority and some of the small businesses, the real small business. I went on the floor early and often to talk about independent contractors. One of the first on the floor and say, don't get our barbershops and our beauty salons, some of the old businesses in our culture making money. And so then afterthought, but thank goodness that we were out there, the Congressional Blacks, the members of my party, fighting to make sure independent contractors, for the first time in history, they were able to get unemployment. And we dared to give them an additional $600. People said too much because they were making more than what they earned. And we already know that we're the lowest paid. Black women, as powerful as we are, we make less on the dollar than our white male counterparts. We make less than white women doing the same thing know many of you like me grew up when my mother and my father said to me, you have to work twice as hard. And my father reminded me, I wasn't working twice hard to get a greater opportunity. I was working twice as hard to try to even be in the room to be considered for an opportunity. And so this is our moment, this is our time. And if we don't stand up for all of the injustices, let's not take this time and only make it about one issue. Let's not let them tell us we have to pick healthcare over economy. Let's not tell them that we have to pick economy over housing. Let's not tell them that we have to pick education or economy or healthcare over housing. If this is our opportunity, let's say we want equality and justice in every field that we walk in, we work in, and we serve. And we can do that because we are up. Thank you for letting.
Oh no. Did she freeze? Did we lose her?
I know I was late, so I'm here. I do whatever Angela tells me to do.
Ms. Beatty, thank you. You froze a little bit, but we are so grateful that you could come on and give us the pep talk that we need. In case y'all have never seen Congresswoman Joyce Beatty, that is her all the time. And that's also a formidable—
Are we still connected?
Moderator.
Sure
I hear you a little bit, but you're still a little frozen. Oh, there she is. Ms. Beatty? Nope.
Yeah, I think her camera's frozen.
We'll come back to you. I want to do one thing really quick because I think it's so important. You hear all the work that Ms. Beatty is doing in your bios, right? We hear that all of the work that you all are doing every single day to fight for us, to fight for your families, to fight for your communities. What I think is so important, there's a meme on Instagram for those of you who are on the gram. I'm sure it's circulated on Facebook too, if y'all are Facebook folks. It says, don't forget to check on your strong friends. Mm-hmm. And you all being here, even the folks who called in, the attendees, if you're texting with any of your friends who are on right now, just check on them and say, how are you? Ms. Beatty, I know we have you back. And I want you all just to briefly do that, because what I don't want to do is skip over what Dr. Kane is talking about with the PTSD and the trauma and the suffering that this moment has caused us, both on the COVID side and on the racism side. So if we could briefly just check in, I want our folks, our sisters, to know that it's okay to not only check on your strong friends, but to those who you might not think are as strong too. But let's set the example really quick. If we could, because I know our time is limited, just go through that really quickly because we have some substantive questions to get you to, but I do not want to skip over you all's wellness and your health. So Ms. Beatty, I have you back. So you want to answer that? I want you to know that we're here for you. You're on mute. Let me see if I can unmute you. Nope. Are you off now?
Can you hear me now?
I can hear you.
Okay, thank you. I hope you got most of it. I get so excited when I see so many strong and powerful women, and we're standing together, and it's our moment to come together and to be in this fight to make a difference. And I certainly agree when we talk about checking on one another. Many of you may know that I was actually out there at a peaceful protest, and I actually got pepper sprayed.
Whoa.
And the good thing about that was I was in the right place for the right moment to help make a difference. We are now changing laws in my community as a result of that. But it's almost just like George Floyd. Black folks have been killed at the hands of unjust police officers. I mean, we could do the list that all of us know. But this is the right time and the right moment. And I think that has to be our theme. And Angela, you are right. We have to check on our strong sisters. We have to check on our sisters who may not be in the same space at the same time that we're in. And that means the world to people when you say, how are you holding up? Do you need something? And those are the things that we can do and should be a part of our platform, because when you reach out and help one, you bring one. Yeah. And I can tell you for this election, we're going to need to bring everyone. And this isn't partisan politics. This reality we are living in a time we can actually have a sister to be vice president. The second most powerful person in this country could be a sister, coupled with, in succession, the third most powerful person already in this country is the Speaker of the House, who is Nancy Pelosi. What a wonderful time. Let's not let this be a missed opportunity and let other folks get us sidetracked and forget that it is about all of the issues, but being at the ballot box is issue number one. If we don't get out there and exercise that our vote is our voice to make a change for women, to make a change for Black women, shame on us. Shame on us.
Thank you, Ms. Beatty. And I want to give you all, the rest of the panelists, an opportunity to ask. Nurse Alice, I introduced you early, but I haven't heard from you yet, so I want to start with you after Ms. Beatty. Thank you so much. How are you?
You know what? I'm doing well, and thank you for saying that message about checking on our strong friends, because maybe what didn't necessarily make my bio is I'm an advanced practice nurse. I work in ICU, I work in the emergency room, and I do critical care transport. So when it comes to taking care of people, I take care of people when they are on that last leg. You know, just the other day, transporting a COVID patient who was actively having a stroke to a higher level of care, someone of color. So when we talk about health, listen, I feel some type of way about it because I directly see frontline what's happening in the crisis. It's one thing we all want to, you know, health promotion and prevention are very, very key aspects of health, but we know that our brown and Black people don't always have access to quality health care. We are often pushed off to say, oh, you know what, you're having chest pain, it's probably indigestion, go home, take some Tums, lay down, and you know, our complaints are displaced, and you know, people don't believe us. And in the hierarchy of when it comes to patients who are quote unquote believable, there's research out there, medical research that shows that when someone walks into the emergency room, do I believe your complaints based on what you look like? Well, we believe the white male, then we'll believe the Black male, then we'll believe the white woman, and the Black woman is last on the list. It's something else. She's drug seeking. Maybe she's just stressed. Maybe, you know, it couldn't necessarily be what the woman is saying it to be. And we know this to be true because when you look at people such as Kira Johnson, I don't know if many of you know her story, but when we were, you know, and we won't maybe not get there, but when we talk about maternal morbidity, she had insurance, very intelligent, was at one of the best, supposedly, hospitals in the world, and still had, you know, suffered death in a planned procedure. So they're not believing Black women. So this is something that I'm very passionate about. I want Black women to be educated, to be relentless, to be fearless when it comes to our health, not only of ourselves, but for our families, because oftentimes, you know, we make the world go round in the family. You know, everyone wants to listen to mama or, you know, grandma. So we have such a powerful voice. I really, really want to make sure that we use this. And I'm so glad that we have all these lovely people on the panel. I know we have a limited amount of time, but there's just so much that I want people to know when it comes to health, because although I love meeting people, I really, you know, I'm meeting you in the emergency room. I'm meeting you in ICU. I wish I could have met you at your primary healthcare prevention wellness woman appointment, because there's so much that gets lost in the translation oftentimes. And I'll say this as a health, and I'm proud to be an advanced practice nurse, but our healthcare system is failing us. There's no doubt about it. And it's not because we don't have, our politicians don't have necessarily good intentions, or that our healthcare providers don't necessarily have good intentions, but the way that it's operationalized, the way that implicit bias, because of lack of cultural diversity in our healthcare workforce, so many of us, and I'm talking Black women, as well as our, you know, our Black sons, our Black fathers, are falling through the crack and not getting the care that they receive.
Thank you, Nurse Alice. Linda, I want to go to you next. And I want to double down on the fact that we know this conversation is limited. We are going to get to some of these questions, and we want to ensure we have time for the audience questions as well. So if you could answer me, how are you? I promise we're going to get to some other questions too. Thank you so much, Linda. You have the floor.
I am right now at this moment in time, I'm doing okay. I'm on a call with amazing, intelligent, brilliant, accomplished Black women, and a whole host are listening. And that gives me strength, that gives me motivation to keep going, to keep making sure that women know that, yes, Black women, we are fearless. We do deserve the best care. You know, not all of us are lucky enough to have providers like Dr. Kane and Nurse Alice. So I'll leave with one thought, which is, when you go see your provider, if you don't like the care you're receiving, find another provider. You don't take bad service from the cable repair guy, don't take it from your provider at all. So I'm fine for now, and I'm gonna stay in this fight because I know I'm supported by all of you, and we are going to get this done.
Thank you. Alethea, how are you, sis?
I am doing okay. You know, Nurse Alice brought up a great point, as did Dr. Kane, about stress, and you did as well, your girlfriend. And so recognizing that and giving voice to that this is a stressful time. The pandemic was one thing, and now we're also coming through with the racial equality movement. And so giving voice to the fact that I am stressed, right? I am, and just trying to find ways to deal with that. But it's okay to admit that. We don't have to continue to just move forward. It's okay to be in that moment of, this doesn't feel good, and maybe I can't breathe, or I don't have words, but I'm doing okay.
Thank you so much. And Dr. Kane, I do want to come back to you. I want to tack onto your question though. The point about Black women not being believed. So I want to ask you how you're doing first, but I think this is really important, and we do need our sisters to be empowered. Linda, thank you for ensuring that comes back up. But I'll start with you, Dr. Kane, first on how you're doing, and then I have a 1B on my question.
Well, you know what? I am just so refreshed by just being among this talented bunch of individuals. And hey, Congressional Beatty, let me just say, she was a ball of fire. She came to Indiana with Judge Glenda Hatchett on maternal morbidity. Mm-hmm. And you know, when you see those people, the enthusiasm, and all of our panel members, because we're out there, we're on the front lines with everybody else, that just, you know, refreshes us and gives us reassurance that we're doing the right thing. And it's a passion with us, and we got it in our heart. So yes, I'm extremely busy, but yes, I know you've got to take time for yourself. You got to find those moments for reflection and how to keep on going on, because so many people depend on us. If I did half the things my mother did, and she came from a small little town in the South, it's a legacy that we all as women need to carry, because we are the caregivers for the folks in this country. And I think it's only through our leadership and getting out there that we can push straight ahead and be in that winner's circle. So thanks for asking me.
Thank you. Okay, 1B is, I have a friend who was contracted coronavirus, was having seizures, and went to the hospital. They called 911. The doctor did not believe she was having seizures, was unconscious, slapped her, was unconscious, punched her in the chest. Having seizures and not believed. So I'll start with you, Dr. King, but I want all of you to be careful, but you can't necessarily expect it.
So to piggyback on that, I want everyone on this call to realize that when you step into your provider's office, they work for you. You can fire them. You can find another provider who's going to listen to you, because oftentimes you can come in, you can have a list of complaints. They've already made up their mind. They haven't even seen you. They just looked at the paperwork and looked at the labs and said, oh, this, and this. And you know, they're gonna make decisions. I've seen it. I hate that's true, but we need transparency and honesty. So you all, everyone on here, can make the decisions they need to, so they get the care that they want, but they work for you. And these healthcare providers, the cultural diversity and training needs to be at every step of the way, from when you apply to medical and nursing school to every single class that you're in. It needs to be woven, not this 1-2 hour annual cultural competency thing you do on the computer to check the box that, oh, I've done it. No, that's not how this works. And it's also very unfortunate that So Dr. Kane was saying she had to fight. I had to fight for both of my parents as well. And listen, you don't want it, because I got time. I have time, and I will go there with you. But you know, it's so tragic that you almost, if unless you're a healthcare provider, or you say, oh, my sister's a doctor, or my brother's a provider, it's almost like you get a lower level of care. And like Linda was saying, you almost have to, name drop or drop some receipts before you will get the care that you want. And that's not acceptable. So everyone, when you're going in, if you feel like you're not getting the treatment that you need, you're not made to feel better about what's going on with you, you need to start asking, well, why aren't you doing this? Let them say that. And then take a little piece of paper, go and write the little note. They don't know what you're writing, but write a little note. And because you do. We have to put this pressure on the healthcare system.
Oh, yeah.
Otherwise, there won't be a change. There will not be a change if we don't.
Here's the thing
And
that
Angela,
I have to bring up. Miss
Angela,
Beatty,
can I say this, Angela?
I was coming to you anyway. I had a frame for you. Real quick. So I just was gonna say, what does this sound like to you? Doesn't it sound like The Hill? Like you have people with interest and you have to build a whole lobbying campaign around what your needs are, and they work for you. It's the same thing. So I think this is such an interesting parallel, Miss Beatty, because so often, our folks are like, I don't like politics. Politics are everywhere, even in the doggone hospital with your family members. You're having to advocate and be political. The name dropping, sometimes you have to name drop the head of the hospital, but you can also say that you're close to this congressperson. Miss Beatty, how many calls do you get like that where you have to intervene? I'm yielding the floor, ma'am.
Let me tell you, every day, and let me just clarify when I said, don't make us choose. You gave me the perfect setup from our medical professionals. But the answers you're giving apply to us because we can name drop and we know how to do that. So when I say don't make us choose, because that sister that's out on the street and is homeless, she's not going to be able to do what we're doing. For her, it's housing and healthcare. For that mother that dropped out of school and doesn't know how to read the forms, and they're saying, check this box and do this before we take her. They leave the hospital because they can't read and they don't want someone to know. So it's all interwoven, but healthcare is the first. And it happens to all of us. 20 years ago, I had a cerebral brainstem stroke. Now, I know that I was at the age, I didn't have any of the signs. I wasn't drastically overweight. I didn't think of someone having a stroke unless they were old. My grandmother died of a stroke and heart attack, but she was 90 years old. But what happened was a doctor said to me, to the healthcare's point, your cholesterol is a little high. I know now that it's like your mother used to say, it's either clean or dirty. Don't be talking about, oh, it's just a little dirty and I'm gonna wear it. I did not know. I didn't know to listen to my body, or if I did, I wasn't listening to my body. I didn't know to say this is unacceptable. Now I know, and I was lucky. I was lucky because I could do all of those things because I had a support system. So they sent me to a stroke clinic where I was only with 10 other patients. I was able to go back to work because I could have an electric wheelchair. I was able to get the electric shock treatments and it worked, so I didn't have the stroke droop. But my sister that's out here in the street would not have made it, and it would not have happened. So that's why I get so excited when we're on here, because we have to look out for each other so we can carry that message back. But we also have to remember it is politics, because there's so many sisters out there that wouldn't know how to even do what we're talking about. Wouldn't have access to even know who. They don't know the difference between the charge nurse and the lady that's coming in there turning them in the bed, because they all have uniforms on. So I think this is so good because it's going to people who are like us in many ways. They haven't had the fortune, haven't had the opportunities, but I can tell you it is political.
Yeah.
It is very political. If you don't believe it, we got into COVID-19 and you saw who got the PEs, you saw who didn't get the mask, you see how disproportionately we're treated across the nation. The Congressional Black all the data, and we've been speaking out. And that's how we're getting, because we have healthcare providers and experts and lobbyists who are coming to us, and there's enough room for all of us. So thank you.
And Ms. Beatty, to that point, thank you so much. I want to go to you, Alethea, because some of the work that you're attached to is around the prevention piece, right? Like how people can prevent coronavirus in addition to so many other things. I know that we all probably saw the story of the 70-year-old man who ends up with an over $1 million bill after he contracted COVID. So can you for a moment talk about some of the stores and some of the entities that are using drive-through testing facilities and are coming up with other ways to ensure that the virus is contained and not spread as much, can prevent those $1 million bills? Of course, we know that healthcare system needs work, but I'd love for you to chime in here.
Sure. And so, at least from the Walgreens perspective, and a number of other community-based pharmacies as well, have been opening testing sites. And so for Walgreens, over 50% of our stores are located in medically underserved areas. And so we are at a position where we actually can go into some of those hot spots that have the high social vulnerability index. And so we have to date opened 46 testing sites in 27 states, and those are the drive-through testing. And a part of the social vulnerability index are people who are living in close proximity to each other, people who are frontline workers and others. So if you can test, diagnose, then hopefully quarantine and help stop the spread. And so what we've seen is digging deep within communities and using some of those community providers because we're situated in these areas where there are hotspots. And so we have done that and are looking to try to expand across 49 states and Puerto Rico as well. And so we find that to be critically important. Are you muted, Angela?
Yeah, Ms. Rye, you're on mute. We've lost your audio.
Look at that. I muted my own microphone. I'm sorry. Reclaiming my time. One of our friends, Mariko and Alethea Aquila was on, and she mentioned that so much of the conversation around medical help and advocacy put the responsibility on us. Mm-hmm. Surprise, Black women are so used to carrying that particular burden, but emphasized, as you did, Dr. Kane, that a lot of that onus is on the medical professional who's serving us. Nurse Alice, of course, you raised the point around the fact that they were hired and they can therefore be fired. And so I just want to now open this up to some of the folks in this chat room. There's a lot of amening and not as many questions, which I think is a good thing. I think that means you all spoke to the hearts of a lot of the women and people who called in today. There is a question about the role community health centers play in serving vulnerable populations. I don't know if anyone wants to chime in on there. Oh, Dr. Kane, I see your hand.
Okay. So one, let me just compliment Alicia and Walgreens for doing that wonderful thing. You know, one of our biggest issues is that our folks have not been able to get access to the test, to urgent cares with their symptoms and said, hey, I think I've got COVID-19. Well, no, you don't have a fever, and so I'm not going to test you. When they scrounged up $100 to make that visit, and so I had to get that testing done. So community health centers are just critical. They'll take low-income people based on your income bracket, but you know, you should be able to get the testing, COVID testing for free. Yeah. A lot of test sites say, well, hey, you need a doctor. Well, wow, I don't have the money to find a doctor to write a prescription so I can get that test. So we offer in Indianapolis, I'm the doctor for the whole community that's minorities. You want to test? I'm your doctor, you can get it free, not a problem. We have to go into our heavily African-American communities, but let me just say they're not the only people of color that are being impacted. Our Latinx brethren are being impacted. Our Native Americans are being impacted. So I think that that's really, really huge. But I don't want us to forget the homeless. We mentioned it several times that I went into the homeless business, my health department, because I needed to make sure that those homeless are getting tested, and then we can't have them in large facilities where you got 500 to 700 homeless all living close proximity. They can't do that social distancing because one or two gets infected, the whole group gets infected. So wow, we had to set up all these temporary places to keep the numbers down below 200. My other group, hey, we got a lot of brothers and sisters who are incarcerated. We got to make sure that they're safe in those correctional facilities. We got to know that testing is being done appropriately. Infection control is happening. And so I'm in a wonderful city. I got a great sheriff. The folks over our correctional facilities, we work really well together. But we needed to get the folks out who are nonviolent offenders out of those incarcerations and let them be on that, be outside on a bracelet where they're monitored so that they're not crowded in a condition that makes them really at high risk for outbreaks or infection spread. So we need to advocate for things of that nature. So, hey, Congresswoman, you know, you the money lady, okay?
Yeah.
We need to raise our minimum wage. We've got to raise it to a living wage. We got to make that happen. You know, we're being provided food from the pantry and those Band-Aid approaches, but people work hard and they deserve to get the money they deserve from working hard. Inflation has risen, but we haven't risen with the amount of money. We are 8 out of the 10 lowest paying jobs are us. We're in the 8 out of 10 lowest paying jobs. So, hey, help me, Congressman. I know you got the money now.
Dr. Kane, I love that you called Congresswoman Beatty the money lady. That's going to be her new nickname. I'm yielding the floor to the money lady.
You know, one of the
Let me
things
just say, this is why this is so important. I've now gone to where I started, that while healthcare is our main topic, it is economics, it is the homeless. That's why we made sure when we put the $100 million in there, the $100 billion, we took $25 billion for testing. Excuse me, and we wanted to make sure that it went into our communities. But this is just putting a small dent in the problems we make. We do need minimum wage. We need equal pay for equal work. There are so many things that we have to wrap this in, that we have had a culture of being discriminated against. And so this is why this dialogue is so important.
And Angela, if I could just say one thing, we could have gotten ahead of this. I mean, I'm so glad that Walgreens is doing testing, but it takes an hour to train somebody how to perform a nasopharyngeal swab. It really doesn't take that long. It takes 15 minutes to train somebody how to do contact tracing. Had we looked epidemiologically at where the cases were happening and trained people to go into communities who are trusted, known by the people in the community, to collect those samples, get them tested, and then do the follow-up contact tracing, we could have cut transmission by 30 or 40%.
Absolutely.
It wasn't a priority, but had we done that, we would not be, we'd be having a different conversation tonight.
Well, the problem is, I got to pipe in here, we didn't have the tests, okay? So when this epidemic started, only State Department of Health departments had the tests.
But we have them now, Dr. King, and we're still not doing it.
That's true. That's true. You're true.
If I can just mention about the test, so I actually
we set up systems to have a primary. You had to have a prime. Right of what we should have done. You were right that we didn't have the test. We didn't have money. But when we got the money, we set up the systems that you had to go get a primary. We know Blacks didn't have primary physicians, and we don't have insurance, and we weren't going to walk into a major hospital like we were saying. People who look like us politically and not necessarily in elected officials got out there and said, we will put them in the federal-fied centers. We will put them in community centers. We will go to the Krogers and the Walgreens, and we will drive across town and go to an expensive The Ohio State University, but I will go to Kroger. So I will go over in the Black Park where we're now doing it, or in the recreation. So we're making progress. At the same time, people are dying. Not put the isolation, and I'm sorry, I know we've got wonderful healthcare providers on here. You started this by saying the homeless, the incarcerated, infant mortality, it is our health, but we have so much suppression and racism that has gone, that has changed us. We have to make cultural changes, and we cannot be pushed in a corner to be satisfied that we're only going to get it for folks who look like us or for Black. We got to go and get out of prison. And they're not going to have a job, they're not going to have a house, and they're going to have health care. So if we're going for it, we might as well around healthcare being an epidemic and fix it by saying we need more insurance. We need minimum wage and better jobs. I can't go get insurance if I don't have a job. I can't go get insurance if I don't have any money. If I don't have a roof for me and my 2 babies, I don't care anything about healthcare. I'm trying to figure out if my babies are going to sleep at night. And so I'm just, this epidemic wrapped in healthcare, I get it, and I'm down with it, but we cannot have it be in isolation, because if so, you're only going to fix it for people who look like us. You have to say, because all the stuff we're saying is true, you know, drop a name. Well, who's Susie going to go drop when she getting out of prison or the shelter? She trying to find a home. She going in the stealing something so she can get kids, and then she going to get arrested. Right. I know them to get me a public defender or get me somebody. She don't even know the name or the phone number. So I'm saying, when we get out there, let's bring Susie and Bebe along with us. Not dropping names, they're not calling a doctor. So we have to say, doc, minimum wage, the prison, the homeless, the education, and let's wrap it around healthcare. I mean, we talk about infant mortality. We had the highest infant mortality rate in the country in my district. So let's wrap it all around this public health epidemic, but let's not just make it the traditional healthcare, because Black folks aren't in anything traditional. And you know, I am a congresswoman and a politician, and I'm unapologetic if I get a little full of myself, because I'm also the granddaughter of a Baptist minister. So I'm just thankful to be with sisters giving me this opportunity to see words. I'm going to have to sign off. I'm getting ready out of here. I'm going back to Washington so we can vote. Love all of you. Thank you for just letting me be in the room with you.
We love you. Thank you, Ms. Beatty. We're going to transition over a little bit and quickly because we need to wrap up, as you all know, and then shift to closing remarks. What I would like to do, starting with you, Nurse Alice, I know you were ready to weigh in, is just if you can give the women and the people who've called in today and are listening and watching this panel, what is one thing they can go and do from here? I know what mine is. I'm going to save it. But if it is dealing with racism as a pandemic, or it's coronavirus as a pandemic, or you want to give out one of those numbers, Dr. Kane, for how they can, you know, be connected to a health advocate in their community, what are some of the things that folks can do when they leave here? Let's all do one. Let's do a wrap around, starting with Nurse Alice.
I'm going to say that your health is your wealth, and it needs to start with that. There's lots of competing things going on, but you yourself have to be whole and solid so you can, you know, keep up in this race. So that means physically, that means mentally, taking care of your vessel so you can go the distance. You know, part of that is we need to educate ourselves. Not everybody has a healthcare provider, but you know, there are definitely resources out there. And if anything, I know Black women, we are some of the most, if not the most resourceful people out there in the world. So please, 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 whether you have healthcare insurance, whether you go to the community clinic, there are always resources out there. Even if you call the hospitals and say, you know what, I don't have insurance, can you point me to the direction of a community health center? They will connect you with someone. So my first step to everyone is to please make sure that you are taking care of yourself physically, mentally, and spiritually. There is a lot going on. And if any of those things are out of balance, the whole vessel is out of balance. So I'm going to stick with your health is your wealth, and to please take care of yourself so you can be there for everyone else and go the distance.
Yes, thank you so much. Alethea, how about you?
Well, since Nurse Alice has covered the health piece, I will stay in my lane and I'll talk a little bit about politics. Know the name of your representative. So whether it's your city council person, your member of Congress, and be registered to vote. But I say know the name, not in a sort of high touch political spectrum, but they actually have caseworkers. And so when you talk about having other advocates, your local city councilman or congressman often has someone who's assigned in their office to also act as your advocate, whether that is following up with a health institution, or calling a Walgreens, calling someone else and saying, my constituent had this concern or this issue, and how can we help them? And so they can also help you navigate situations. So I would say know who your representatives are and know those numbers and use them.
Thank you. Linda, how about you?
I would say, first of all, know that there's nothing wrong with you. It's okay not to be okay. There's a whole lot going on right now. And let somebody know. Don't be afraid. Talk to somebody, reach out, make that connection. This is really a tough time when we're supposed to be physically distancing, but please don't be socially or emotionally distant. And the last thing I would add is November 3rd is coming up. Make sure you vote early, vote absentee, stay out of a crowd. However you do it, make your voice known. We have a voice. It is strong, it is powerful, and people need to hear it.
Love that. I love that. Dr. Kane.
Well, let me just say, hey, we're coming up to a season that we're going to have both influenza and COVID-19 happening at the same time. And you know, for a lot of us, we didn't have personal protective equipment for our healthcare workers, many of them people of color. So most of you said most of the things that I wanted to highlight, but I don't want us to forget, I don't know if we're too late for the 2020 census, but you know, we need to be recognized for the power and how many people we are held here. And I just want to also say, be safe, wear that face covering out in public, wash your hands frequently, and do that social distancing. There are 22 states now that are, since they reopened, their cases are starting to climb like crazy. Texas, Florida, Arizona, Arkansas. So please practice safe, healthy, preventative type of things, and make sure your loved ones, your colleagues, your friends, your grandparents are doing the same thing. And like I said, hey, let's raise and get our folks out of poverty. And we have to do one thing, and we have to say, the next time, I know you're gonna have this again, right? You're gonna do an update somewhere down the line, right? So we want to be able to say on this call that, hey, we brought someone up. We brought a sister along, okay? And not one that, you know, they're educated, they got the money or whatever, but someone who may not be as fortunate as us, that we were able to bring them along. We can say at least one person we helped.
Thank you so much, Dr. Kane. Let me just acknowledge, I did not see until right now that the Q&A box was separate from the comments. You all asked some amazing, I'm like scrolling through the comments looking for the question. There's some amazing questions in here. There's a Teresa Myers that offered up services and support as a naturopathic doctor. Someone asked about an NCBW advocacy agenda to address health and healthcare needs of Black women and girls, potentially at the upcoming leadership retreat. I know Patrice asked a question. Hi, Patrice. Webb asked a question about increasing access to capital to eliminate debt disparities. I mean, there's a ton of information. You all, what does this mean? When you leave from here, don't leave the town hall thinking that the solutions was just up to this very brief panel. It's up to each of you. You all are empowered enough to do this work. And I hope that if nothing else, when you look on the side and you see the numbers of attendees and you see what this panelist or this panel was able to do just in checking in on each other, that we continue to do that so we know we're not alone. I have one question for you all that's really born out of additional trauma for us, and that is to help us get the killers of Breonna Taylor arrested. There's a phone number. I would like for you all to take it all down and demand that they arrest the police officers responsible. The phone number is 502-595-2300. And to Linda's point about elections having consequences, there is a historical election that took place today in Virginia. Dr. Cameron Webb won in the primary in Virginia.
That's my buddy.
Upset, big deal. And I wanted to save it till the end. Look at Dr. Kane. Look at that. I love that.
I love that guy. He is so talented. My goodness.
So talented.
Oh, get out of here.
Doctor and a lawyer. So y'all look Dr. Cameron Webb up. I did a live with him last week. He's incredible. This panel is so amazing. Mariko, my good sister, President Harris, thank you so much for being here. I yield it now to you all for closing remarks. It was my honor to moderate tonight. Thank you all so much. You were amazing.
Thank you.
Thank you. I'll now hand the floor over to NCBW President Virginia Harris for closing remarks.
Thank you. What an amazing afternoon. There is a lot of information that was shared by our esteemed panelists. I would like to just say to all of the panelists, we had over 764 attendees on this webinar and through our Facebook live session. But I want to take this time to just say, I'd like to just thank the esteemed panelists, Nurse Benjamin, Attorney Jackson, President Blunt, Dr. Kane, and the amazing Angela Rye. Thank you all for being with us this evening. We appreciate you taking the time to join us. So with that, I'd like to just thank the team to put this together, Mariko Bennett, Afrida Stu, Bridget, and our first Vice President, Sarita Tinsley, and Tammy. Thank you all for putting and bringing this esteemed panelists together to provide all of this information. And as Angela said, the solutions are up to all of us.
Yes.
We've been empowered tonight. So hopefully we will take this information and make sure that we use this week to do something with it by contacting those people that you know need our assistance and help. And I want to just say thank you. And we have other webinars that will be coming up throughout the year with the Women Health Imperative and Ebony Magazine. So we're excited about that. So follow us on our website, www.ncbw.org, and find out where we're going to be and register to join us. So thank you, good night, and have a wonderful rest of the week.
All right.
Thank you.